Good morning from the 17 Newsroom. I'm Alex Fisher. It is 10 a.m. and we are breaking into regularly scheduled programming to give you the latest on the coronavirus here in Kern County. As you know, cases continue to spike across the county. We saw 78 new cases reported within the last 24 hours, and another death was also reported. We are waiting from public health officials who are going to give us an update on the latest on the crisis here in Kern. We should be hearing from them momentarily, but first let's go over the numbers as we know them as of now. 3,600 people have tested positive for the virus in Kern County. 58 people have died. About half of those deaths come from skilled nursing facilities in the county. More than 2,400 people have recovered, and since June 1st, we have consistently seen an incredibly large spike in cases. Our current peak is 113 cases on 115 cases, I should say, on June 1st. And since then, each day is seeing roughly around 100 cases. So again, within the last few weeks, we have seen a huge spike in new cases. And again, we are still waiting from public health officials to give us the latest on the crisis here in Kern County. We also have some updated numbers on hospitalizations. 69 people are currently in the hospital, and again, here's the latest numbers on your screen right now. 69 people are in the hospital as of now. That is down significantly from just a few days ago when we saw more than 80 people in the hospital. So again, that is some good news there. We've seen a little bit of a decline in hospitalizations. However, our ICU rate continues to be very high. According to the State Public Health Department, they're reporting 39 people are currently fighting for their life in intensive care at the moment. You may remember back on Monday, Director of Public Health Matt Constantine of our Kern County Public Health Department gave us a look at the projections that they have, which shows that by late next month, our county could go to the capacity levels of ICUs in the county, which means that hospitals right now are preparing for that possibility. However, they do say that they have plans in place if the county were to reach that capacity. The other projections show that we could see a peak of coronavirus cases here in Kern through until February. So their projections that they show say that we are far from being over. We are far from even seeing the worst of this. Again, we are still waiting from Kern Public Health officials. They are going to give us the latest on this crisis. And again, we will give you those remarks as soon as we hear from them. But again, let's just go over the new numbers from today. Kern Public Health has reported 1 new death. That brings our total to 58. We saw 78 new cases. That brings our total to 3,600. That includes 10 non-residents who tested positive for the coronavirus here in Kern County. As it stands right now, 1,082 people are currently infected with the virus. Most of those, of course, are recovering at home. 69 people are recovering in the hospital. But again, over 1,000 people are currently infected with the virus. And like what I just mentioned, 69 people in the hospital. 39 of those people, according to the State Department of Public Health, are
3,590.
It looks like we just got our picture up from Public Health. Let's take a listen in. This is County Administrative Officer Ryan Alsop. Let's take a listen.
Of the 3,590 residents who've tested positive, 3,463 or 96% have either fully recovered or are recovering at home, treating their symptoms on their own, again, on a daily basis. This percentage has been consistent for months now. Today, 69 residents, or 2% of those who've tested positive are receiving care in the hospital of some sort. Some of those are ICU, some of those are receiving other care. Unfortunately, 58 residents, or 2%, of those who've tested positive have passed away. Quickly, on the Kern Recovers program, we have issued forgivable loans totaling about $5 million, nearly $5 million in funding across 197 different businesses, 101 different industries here in Kern County. The average loan that we've provided out is about $23,000, and it is taking from the time of application to the time money lands in bank accounts about 14 days. That average, 14-day average, was smaller before we opened it up a little bit wider. The workload, the processing has taken us to about 14 days. It's still very quick, and we would ask that all businesses, if you have not received a PPP, a federal, any sort of federal assistance, to go to kerncounty.com and look at the information. If you're a small business in this community, again, whether you were non-essential or have been essential all along, as long as you have not received any federal assistance to date, you are being prioritized. Go and submit your application today at kerncounty.com. On Tuesday, the Board of Supervisors approved a $5 million program for PPE, personal protective equipment, distribution to small businesses in Kern County. We're going to target 5,000 independent small businesses throughout the county. This program has been approved by the Board of Supervisors, and we will be rolling this out in the coming days, and you can look for information on kerncounty.com. Food insecurity, also on Tuesday, the Board of Supervisors approved a $2 million program for food distribution to vulnerable seniors and residents here in Kern County. This is made possible through the Federal CARES Act. This is a program that's managed by the Community Action Partnership of Kern, or CAPK, and we're pleased to get that program out and get food distributed to our vulnerable seniors, those 65 and up, in addition to other residents who may not be over 65 but have some significant hardships medically that make them most vulnerable to complications related to COVID. And lastly, also on Tuesday, I wanted to say a word about homelessness. The board approved a little bit over $2 million, $2.1 million to be exact, in grants. These are grants that are provided by the state and federal government for homeless service providers throughout Kern County. There were many, many homeless service providers that are going to be receiving this money. This is to assist them in our fight to address homelessness in our community, particularly during the pandemic that we are dealing with today. And with that, we're going to open it up to questions. Again, Megan's not here, so I'm going to play her part. And we've got a list of media outlets here. We have, the order switches each week. We're going to remind you that when I call your name, to please push *6 to unmute your phone so that you can ask a question, and Kim, Matt, and I will do our best to answer any questions that you may have. So we're going to start with channel 29.
Hi guys, good morning. Thanks for your time. Couple of questions specifically in relation to those meetings you guys recently had with the state. Do we have any more specific details about what steps we're going to be taking in order to tackle that problem we're seeing in our nursing homes?
I'm going to ask Mr. Constantine to answer your question.
Thank you.
Good morning. So we have gone through our list of 5 areas of concern: the continued patients' admittance during an outbreak, the mitigation plans, the disease tracking, the employee and patient testing, and the oversight and enforcement functions from the state. So those have been the topics of our discussion. We're developing action plans based on those areas of concern. The state has offered to do joint visits They've offered to send down additional resources. They are addressing some of these concerns internally to see what options they have. So it's early on. We have daily meetings now scheduled with them to check in and figure out what we're all doing. So it's a little early, but they have committed to work with us and to look for solutions and to try to fix this. So I'm hopeful we'll have more. When Georgiana Armstrong is attending, she can also provide you an update, as she's been integral in these meetings. Did that answer your question?
Right. Yes, a couple more if you guys don't mind. How have these facilities responded? I know us on the media end, and I appreciate that we have a very different role than you guys. How have they responded in terms of cooperation? Because I know we've had a difficult time, and I believe some of my colleagues have as well, with getting in touch or getting answers from some of these folks.
Well, since these are facilities that we have not traditionally had contact with, we don't have relationships with, we've had to start from the beginning and to try to figure out who owns the facilities. Is it a corporation? Is it an individual? Try to obtain contact information. So it's been slow since we had to start from the beginning. And to be honest, we've had some struggles at times as our role is less defined as the state's regulatory role is. But once we have indicated that we can provide resources, we can help with testing, we can provide personal protective equipment that we actually will deliver, that we can provide training on PPE usage, it has helped. We've worked with the state when we've run into some problems where we needed some greater level of cooperation. So it has improved. I think there's still areas that we want to improve further, but it's been going okay.
Sure. And two more quick questions, if you don't mind. These facilities are still accepting patients, and I know that that's something you discussed, Mr. Constantine, with the board on Tuesday as a point of concern. Is that also something that's been discussed with the state? Because to an outside observer, I would argue that that seems kind of insane to be accepting these patients when the situation isn't really under control.
Yes, so you're right. I think if we have uncontrolled outbreaks occurring at a facility and we are accepting new patients, that is irresponsible, and I think potentially puts that individual at significant risk. The information that we get from the state shows that at some of these facilities the census has increased. The facilities have indicated that at times those numbers aren't correct, so we've asked the facilities to reconcile those numbers that they are submitting to the state so we have accurate numbers. We've asked the state to explore all options to not allow new admittance to a facility that is struggling with an outbreak, struggling with staffing, obviously struggling with disease control methods. But it's going to take some time. So we've had some conversations last night with some of the facilities to try to clarify their policies. It's not done. But most importantly, we've asked the state to intervene and to explore what their regulatory abilities are, because in Kern, we're going to struggle with enforcement since we have no statutory authority to regulate. Right.
And my final question, guys, is kind of on a different note. KHSD is going to have their graduations coming up soon. One of the first kind of large-scale public events we're seeing since the pandemic began. Have you guys been in contact with them, or have they reached out to you, just in terms of some form of cooperation and passing on your ideas, or what's been the status of that?
Yes, so Kern High School District has provided us with a binder of information, and we've had conversations with the Kern County Superintendent of Schools about graduations. Our general guidance here is every elected school board can make their own informed decision on how best to address this. The guidance that we provided is the governor's stay-at-home order is still active. He has still indicated that gatherings should not occur, and that means no gatherings. At times there was discussion about limiting the number of people to less than 250 or less than 100 or less than 10. In fact, it's 0 people. So that the restriction on community gatherings from the state still exists. Now, with that said, the schools have been looking at ways to conduct some sort of graduation ceremony. Our guidance is to adhere to what the state has issued. Although this is obviously a pivotal time in a person's educational career that we want to honor, we need to be careful as we see that COVID-19 isn't going away. It's still here. We have concerns about ICU beds and hospitalizations. We think a drive-through sort of graduation is probably the best if you want to do anything. But anytime we have any sort of event or gathering that potentially could expose more people or could tax the hospital system, we need to be cautious, and we need to postpone those events or cancel until we have better guidance from the state.
Thank you for your time, guys.
Thank you.
Okay, KGET 17.
Hi, good morning. This is Karen Hua from KGET. Thanks so much, for all the information about the nursing homes. As we've seen over the past few weeks, the average daily number of cases has gone up, nearly doubled from about a month ago. We're on a monitoring system by the state. Is it still appropriate to allow these nail salons and other businesses to continue opening? Has any retraction or regression been seen on that front at all, or is that a concern?
I think we are. We've continued to say that we have concerns about our hospital capacity, and particularly with our ICU bed capacity. The state public health officials are the ones that are issuing the guidance for those particular businesses to reopen. They, in issuing those guidance documents, believe that following that guidance limits the spread of COVID and protects people in a substantial way. And so they provided a pathway for those particular businesses to open. And here in Kern County, those businesses can begin to reopen as long as they are following that state guidance. It is that guidance, those documents are very specific in many, many areas. There are sets of considerations in addition to the to mandates and recommendations. They're very, very thorough documents. And again, those have been provided because state public health officials believe that following that guidance, though that business activity can be done in a safe way, protecting everybody, employees and customers. But getting back to your point, as we continue to reopen, as we continue to move along, to Matt's point and the points we've made in previous press conferences, this virus is here. It is spreading through our community. It will continue to spread through our community for months and months to come. And it's important that we make sure that we're doing all of these things and going about our business following the best practices that are being provided by the state and the guidance. And so we'll continue to monitor ourselves across a number of areas that the state is working with us on monitoring: hospitalization, positivity rates, ICU bed capacity. All of those things continue to be monitored, and we want to make sure that we're doing everything that we can to again, at the end of the day, to make sure we have ample hospital capacity. So we need everybody to follow the guidance, and certainly those businesses need to follow the guidance. And if you're patronizing those businesses, you need to adhere to the guidance and directives of those establishments as you visit them. Hope that answers your question.
Yeah, certainly. Just a quick follow-up on that. We've seen just a few instances in Larson County and Sonoma County where, they were given the clearance to go ahead and reopen, but then a few weeks after that, because of a spike in cases, businesses and reopenings have had to scale back a bit, move back. Do you have that concern that may happen in Kern County, especially, given that there may be in-person graduations, just a few things perhaps out of your control happening at these businesses that are reopening?
Yeah, I can't comment on the other counties. I really don't know much about those two particular counties. But yeah, again, we have concerns about our hospitalization, our capacity, and our ICU bed capacity at the end of the day. It's, again, why it's important for everybody to follow these documents and guidance. We have to learn. We can't all crawl back into a cave for the next year. If you looked at Matt Constantine's curve, which it was a model, and if you looked at that model stretches all the way out into February 2021. So we can't just shut everything down for the next year. I think that everybody would agree with that. We have to find a way to begin to reopen businesses, start business activity, but do so with adaptations and under public health guidance. That's what we're doing here. That's why we're here saying follow that guidance, practice social distancing, wear masks. If you're not able to avoid being around people for sustained periods of time closer than 6 feet. I drove in today. I hear people that say, well, I'm driving around and people aren't wearing masks. Well, I drove into work today and I saw all the employees and other people over at Mission Bank on the corner all walking into their business, all wearing masks. I drove into the parking lot here. Everybody entering the courthouse, they're all wearing masks. Everybody in this building, when you come into the county administrative center, you're wearing a mask when you're going through public areas. We're washing our hands regularly, rigorously. We're not touching our face. These are all things that we keep hammering home. We have to find a balance, and this is why we need people to be vigilant, be aware. Yes, Karen, we have concerns, but this is why we continue to communicate the way we're communicating, to continue to ask you as media outlets to continue putting out the guidance and instructions and best practices and hammering that home to the public. And if we do these things, we believe that we can, again, continue to flatten the curve and maintain our hospital capacity at the end of the day, which is what this is all about.
Thank you very much.
Yes, ma'am. Okay, KNZR. Okay, KUZZ. Okay, moving on, Bakersfield, California.
Hello?
Hello, we hear you.
Can you hear me?
Yep.
Okay. Yeah, this is Sam with the Californian. Today I'm wondering about the positive cases that continue to come in higher than a few weeks ago. Does the county have any idea about what's causing this increase in numbers? And a follow-up question to that is there anything that we can do to flatten the curve? Because this model is showing that we're going to run out of ICU beds and hospital beds in a number of months. And I'm wondering what strategies is the county planning to do to address that?
Yeah, Sam, we covered that fairly extensively last week, but I'm going to ask Public Health to come up and see if they can provide some answers to those questions for you.
Okay.
Sam, good morning. First thing to consider is what we have provided from the state is a model, and it is just that, a model. and it gives us an ability to plan what we should do in sort of the worst case scenario. And it's affected significantly by a number of variables. Probably the most significant variable that affects it is our ability to adhere to these interventions, as Ryan has talked about. That has the most significant, and we have flattened the curve as we have looked through the months. We have made an impact. We are seeing just over about 80 cases a day on average. That does change a little bit. So we are really re-emphasizing those methods that have been proven to work over the last couple months. We have developed another wave of outreach that we're doing. Actually, we're doing some filming today. We're trying to figure out how to encourage more and more people to adhere to it. You'll see a lot on our social media about using some community leaders to try to send home the message too about face coverings and hand washing. We're going to continue to monitor Kim's group. There's more than 60 people that every single day are on the phone talking to those that are positive and asking what activities they've engaged in to try to determine if there is a common source of exposure. And if in the future we obtain information that says this type of activity seems to be more associated with some sort of case, then we would want to take some sort of action towards that. But to this point, we have not observed that. So it's to monitor, it's to encourage the testing, because the key to the testing is you identify those cases early, you help isolate, and then contact trace those cases to help control. But so all of those together, I think, is been proven to help. We just need to keep the effort up and stay the course. Anything else, Sam?
I'm just wondering about, I haven't heard any other common source of infections other than skilled nursing facilities, and it's been weeks and weeks and weeks now. So is there anything that comes up over and over again in terms of how people get infected?
So Kim Hernandez is going to volunteer and come up, and she might have a little bit of information for you.
Okay.
Hi, Sam. One of the most common groups we see is actually within households. So people in the same family, once you are infected, then it is not unlikely that others in your same household become infected. That's our most common situation that we see. We do see occasions where people tell us about other friends outside of their household or other people they have been in close contact with. Our process is to follow up those close contacts to ensure that they understand that they are close contact and should quarantine from their exposure. We continue to follow them through their quarantine period. In many cases, people go to be tested, and whether or not they are symptomatic, we follow up with those results, and we make sure that if they are indeed positive, we start that process again to find out who they've been in close contact with. Hopefully when people are quarantined, they don't have close contact with anyone outside of their household, and that helps mitigate the spread. We continue to interview all of the patients to find out where they might have been while they were infectious, as well as where they might have been in the 14 days before their symptoms started, to see if we can identify a common exposure in the community, in a workplace, and things like that. We follow up on those when they occur, and then we continue to look out to see if there is a large group of people associated with a specific location. At this time, we haven't had any large outbreaks that have, had ongoing transmission with outside of large families. So we look for small instances where we do have people who have connections to each other. We follow up on all of those, but we luckily haven't had giant outbreaks associated with any particular community event or location.
All right, thank you.
Okay, thanks for the question, Sam. Kern Radio.
Good morning. It's Ralph Bailey.
Good morning, Ralph.
This question comes from our program director, J.R. Flores, who knows someone who contracted the disease, and as Dr. Hernandez just pointed out, obviously the husband got the disease. And after 2 weeks being deemed recovered, he still had a nagging cough after a couple of days and got retested and tested positive. Could that be a false positive? Should he not return to work? And should folks who have been, and what constitutes recovered?
Okay, good question, Ralph. Let me ask Ms. Hernandez to answer it.
Good morning. The guidance we follow at Public Health is CDC's criteria for releasing patients from isolation. And so once they meet that criteria, they are released by Public Health. We always encourage patients to follow up with their healthcare providers to make sure that their own medical status is indeed recovered and well. The question about testing is a common one and a very complicated one. We know that the molecular testing, the PCR test, the swab you get in your nose, those tests can remain positive for a long period of time after a patient has indeed recovered and has no clinical symptoms. We know from watching particularly patients that were identified early on from the cruise ship exposures that people can remain positive for weeks to months after their clinical illness. The infection that they have, CDC has noted that there are often times where the PCR test does not correlate with an actual live virus. And so that even though that patient continues to test positive, they don't have infectious live virus that can be transmitted to other people. We call this dead bugs when there is there are viral particles that are still being picked up and detected by the test. From a public health and communicability standpoint, once those patients meet the criteria that CDC has put forth, they are no longer required to be isolated at home or isolated from others, and they can return to regular duties such as going to work. Those criteria include for a patient to have had at least 10 days since their symptoms started, for their fever to have resolved for at least 3 days without the use of any fever-reducing medications, as well as improving respiratory symptoms. In particular, the cough can hang about. We know that that tends to be one of the last symptoms to fully resolve. But once those patients meet the criteria set forth by CDC, they are not considered to be infectious, and they're released from isolation by public health. If a private medical provider would like that patient to continue to stay off for their own personal recuperation, that's between that patient and their healthcare provider. Hope that answers your question.
Thank you. And I have a follow-up. Following up on Karen Wah's question, and I don't mean to be negative, but what would a fallback look like? In other words, would you all come out and say, hey, local businesses, we're getting close, you need to ratchet it down? Or could it just be one day you come out and say, look, you've got to either ratchet it down or we've got to shut down? I mean, what would that process look like, given the fact that most of the physicians that I talk to say we ain't seen nothing yet?
Yeah, I don't know, Ralph. I mean, the answer to your question is we don't know at this time what that would look like. That is going to be something that we will be working with the state on. We are in constant contact with state public health officials in discussion across all of our monitoring requirements and key data sets. And we are talking to them when we do see trends in any one of those, whether it's on hospitalization rates or positivity rates. The idea is to have targeted discussion about why we're seeing those upward trends and how we can mitigate or address those trends to get them back in line with the state guidance. But with regard to let's say that we we see a trend in any one of these or across multiple data points trending upward. It's you know, we don't have a playbook on this. This is going to be done carefully as we go forward, and we're going to have the data inform what we do. I've said it before. I'll say it again. You know, it is not, if these businesses are operating under the guidance that has been provided by the state public health department, if they are operating in a rigorous way, practicing those guidance, making sure that their employees are following all those protocols and practices, making sure that the patrons are adhering to those practices, you know, businesses are going to be okay. This is about individual people really not making very good personal decisions, not regularly washing their hands, not you know, wearing a face mask if they're you know, going into groups of people, not wearing a face mask, close proximity, you know, not adhering to all of the suggested, you know, the recommendations that that have been put out. So it's very important that everybody continues to practice good hygiene. That's the #1 way that this is slowed and the curve is flattened. Distancing, masks if you can't distance. Those are the things that are really, that's the, you know, the cornerstone of keeping the curve flat, avoiding getting into trouble with our hospitals. Does that answer your question, Ralph?
Absolutely. Thank you.
Okay, sir. Okay, channel 23.
Hi, can you hear me?
Yes, we can.
Okay. So I feel like all of my questions have genuinely been answered, so you can pretty much move on. The only other thing that I kind of wanted to hear is kind of like the way that you guys are having discussions behind the scenes. I know that you guys do not want to obviously shut everything back down. So the disciplinary action, that's basically my only concern. I'm just wondering if public health is considering, if we do see that we are starting to overwhelm our healthcare system and the only way to mitigate the spread is to simply start, you know, enforcing this a little bit more. I'm just wondering if that's at all on the table for discussion. But overall, that's my only follow-up question. Everyone's pretty much already addressed everything.
Yeah, those are, appreciate that question. Those are decisions, discussions, things that will need to be decided and determined by what it is that's happening and why. Which, you know, where are we seeing a problem? Why is that happening? And trying to make the very best decisions that we can to target that particular problem and address it. And, you know, any number of things could, in fact, be done. It's just we don't have that answers to that question at this point. But obviously, it could come. There could be, you know, whether it's the state or the county or the state working with the county, you know, additional guidance, additional directives, reinforcement, additional reinforcement of the guidance that we have, you know, all of the greater communication with the community, greater outreach, targeted outreach, geographical, institutional, et cetera. All of that would be on the table, and we need to be flexible and open to doing whatever we can to address any problem area that is identified. And I would argue we ought to do that, you know, in a proactive way, obviously. But again, just go back to the one point. This, for us, is all about hospital capacity and our ability to treat people in the hospital that need to be treated, both ICU and also regular hospital beds. It's not just COVID patients. These are patients that require hospitalization for any number of things. We need to maintain that capacity. That's what this is all about. And that is really the driving factor and will be on how we, evolve from where our current position.
All right, thank you.
Yes, ma'am. Kern Soul.
Hi, this is Elizabeth. My question is, I'm not sure if this has already gone over. I'm sorry if I missed it, but it's a quick question. How many of our COVID-19 fatalities are from skilled nursing facilities?
We'll give you the exact number here. And
Just 1 second. 27 deaths from skilled nursing facilities.
27 today.
Okay, and then all of my other questions were already answered, so thank you.
You're welcome. Thank you. Mojave Desert News. Mojave? Okay, and Valley Public Radio. You push, again, reminder, *6 to unmute your phone.
Good morning. Can you hear me?
Yes, is this Valley Public Radio?
Yes, it is. This is Carrie Klein here. Yes, thanks for bringing me into these calls. I appreciate it. And my question, let's see. I have 2 questions, and they've been partially answered so far. I did want to know some more specifics about what's been happening with the numbers at skilled nursing facilities and also prisons. I believe that those are two things that the state highlighted for why they brought Kern in as targeted engagement. So could you give us the specifics not only of fatalities but also just the caseloads at skilled nursing facilities and prisons?
Yeah, I'm going to ask our Director of Public Health to come and answer your question.
Good morning. So we have historically reported on the number of cases within each of our skilled nursing facilities, most importantly of Kingston and Valley Convalescent, both employees, residents, and deaths. I have stopped because we have issues with the data that they are submitting to the state, and the state submits to us. In fact, we have now 5 different sources of data that the state sends to us, and they're not reconciling. They're different. This has been one of our 5 items that we gave to the state to fix, because how do we know the degree of the issue or if we're making improvements if we can't accurately track the disease within the facility? So there is a state website that does have skilled nursing facility numbers. I would suggest that it's not always accurate, but that is a source of information that you can get. They have every single Kern County site on there, plus the entire state, and it lists that data that you're mentioning. And then also with prisons, the state has a website. I looked at it this morning that lists the number of active cases and recovered cases by prison that's on a state website. We can certainly get you that offline if you would like, but I'm certain you can just Google it and find it, and that should have the best information. Hopefully that answered your question.
It does mostly. I have seen both of those websites with that data, but for the state one on correctional facilities, those are the state-run correctional facilities. And it looks like the numbers are actually relatively low in Kern. Are there other correctional facilities that maybe county facilities, other things like that, federal, where the case rates may be higher?
So I'm looking at Kim Hernandez here. Do you want to come up, Kim, and try to answer that?
Hi, Carrie. There are other correctional facilities in Kern County, for example, Mesa Verde, as well as our local jail system. There have been cases reported out of our local jails. There haven't been any from the other facilities in our county.
Okay, got it. Thank you. And then final question. So I understand that, and I don't think that you've answered this already, I apologize if you have, that a number of patients that are coming into hospitals in Kern County, I imagine Kern Medical, perhaps some others, the number of those are coming from out of county. Can you explain if that's the case and where they're coming from?
Yes, so that is a number that we have started to try to track because that could impact local resources. We've talked about this before, but in particular, Imperial County is struggling with some high caseloads, and they have asked for help. So there's two ways that happens. One is informally, when a hospital would contact other hospitals, and that did occur in Kern County, and there's a more formal mutual aid process that goes through the Public Health Department to try to look for local and then regional and then statewide resources to assist with any issue. There could be, in theory too, others that just come from the outside into a Kern hospital. Luckily, most of those are low. Some of the hospitals have taken a few, I think, from Imperial County to try to assist. That is information, though, that the state monitors. We don't have cumulative information from the hospitals about where people live. But again, based on our understanding and our discussion with the hospitals, that doesn't seem to currently be an issue that is taking local resources away at any significant amount.
Okay, thanks a lot.
Thank you.
Okay, folks, I've run through the list. I'm going to ask, are there any other additional questions that may have popped into mind? I'm going to give you an opportunity to ask another question. Anybody? Okay. Thank you very much. We'll see you next week.
All right, so that is the latest from Kern Public Health officials on the coronavirus in Kern County. Let's just go over the numbers one more time. We got some updates on several aspects of this virus. The first, of course, is that there was one more death reported today. That brings our death toll to 58. We've learned that 27 of those deaths come from skilled nursing facilities in Kern County. That means that less than half of the deaths in Kern are from skilled nursing facilities, about 46%. More than 2,400 people have recovered from this virus. There were 78 new cases announced today. That brings our total to 3,600. That includes 10 people who do not live here. Our current hospitalizations, 69 people are in the hospital right now, 39 people are in ICU. That's according to local and state numbers, public health numbers. And again, the one thing that we also heard from our health officials, or at least from county officials, is we're talking about how local businesses, small businesses in Kern County can apply for aid to stay afloat during these times. They said that the average loan is about $23,000 in Kern County. It takes about 2 weeks for the money to be transferred to small businesses. But then again, county officials are asking for small businesses who need help to apply for that aid as soon as possible so that they can get a better idea of how much money needs to be distributed across the county, and also get that to you as soon as possible. Again, that is the latest from Kern Public Health. We will have more coming up today on 17 News at noon. Just a reminder to download our 17 News app for the latest breaking news alerts that can be sent directly to your phone, as well as local health numbers of coronavirus numbers. But for now, I'm Alex Fisher in the 17 News Center. We'll see you back at noon.